My name is Jonathan Scott Hall. I'm a physician working for the Florida Surgery Consultants Group. I practice in the field of neurosurgery where I'm board certified, and I've been in practice in the state of Florida for about 20 years. Very commonly, we see patients that are in need of a neurosurgical consultation as it may relate to degenerative changes in the spine, issues that result from the inescapable aging process. We also see a lot of patients that have incurred injuries or been involved in some misadventures, and oftentimes the patient has issues that are partially explained by degenerative changes as well as traumas that they've experienced. Obviously, if a person comes to see me and imaging studies, diagnostic studies reveal that there's something dangerous going on, then I think the decision making is pretty clear. There are plenty of conditions, however, where it's not a particularly time-sensitive issue, and for surgery to make sense, we want to make sure that the person has successfully exhausted all the non-surgical options. Once we've gotten to that point, or if the patient is suffering from some neurological issue, or perhaps will be left with a permanent neurological problem, then it would certainly make sense to consider and educate the patient about the surgical options.
My name is Pradeep Vora. I am an interventional physiatrist. I did residency in physical medicine rehabilitation and an interventional fellowship in spine, sports, and pain management. So chronic pain is actually a very difficult diagnosis. It's very common. It's when any patient has pain for more than 3 months. Combat that pain early on to help prevent it from becoming a lifelong issue. I usually start with a simple rehabilitation of some type, whether that's physical therapy or chiropractic treatment. So I work in conjunction with them quite a bit, and together just the collaboration between myself and therapists can take a patient very far. Unfortunately, it doesn't always work fully, so then I step in, and I usually start with some of my interventional techniques, whichever it may be specific for that patient. Again, that can help many a patient, but then there's the few that it won't fully work for. And then I work hand in hand with my other colleagues here at Florida Surgery, like the orthopedic surgeons or the neurosurgeons. And we work in conjunction together to see what the best plan of care would be for that patient.
My name is Donna Satman, MD. I'm a neurosurgeon. I've been in the field, graduating since 2004. I joined them in 2019. The majority of patients that I see presently are dealing with pain conditions involving the spine, and they can be acute, traumatic, or degenerative. And many patients are seeking improvement in pain and quality of life. And so that's my goal, is to help them understand where their condition's coming from and what options, surgical or not, may be beneficial in their pursuit of happiness, shall we say.
My name is Odess Frank Cannon Jr. I'm an orthopedic surgeon. I've been practicing now for 36 years in private practice and with Florida Surgical Consultants. As an orthopedic surgeon, I primarily see upper extremity type injuries, sometimes lower extremities, but probably the shoulder is the most common thing. It's kind of like, you have a whiplash in the neck. Well, you can also almost have like a whiplash of the shoulder when the seatbelt holds the shoulder back. So we see a lot of shoulder injuries. Well, you have to look at every patient and see what's going on. And for instance, if we're going to do conservative things like a scope, there has to be certain indications, things that you can actually repair. When we go to actual replacements, it's usually things are pretty advanced, there's wear, and we're doing a resurfacing procedure of the joint.